you are a dental hygiene student in pharmacology and you're struggling with antiviral drugs, this video is for you. Dental hygiene student, let's talk about it. First and foremost, most viruses are self-limiting. They do not require drug therapy. They basically have to run their course. However, the exception to that is HIV. So first up, we have the herpes simplex virus, HSV. We're going to talk about HSV 1 and 2, but first up, 1. HSV 1 is going to be the lips. This is also known as primary herpetic gingivostomatitis. It's those painful red blisters or vesicles on your lips. These are also known as herpes labialis or oral herpes. These are recurrent cold sores. So this isn't something you can get rid of. It's going to stay dormant until you get stressed or something happens and makes you stressed, you know? And the way to treat it, not cure it, is acyclovir or antiviral creams. They're topicals. This is also important. So it can be used as a topical or an oral medication. But like it said in that last one, it's not really good to use topical for antiviral creams on HSV1. Also notice how most of these medications have VIR. It's kind of like a viral medication because it's an antiviral. So this drug right here, the valacyclovir, this is orally taken. This is taken as a prodrug. So you take this and it's going to be inactive as a metabolite, and the inactive drug is taken and then metabolized to activate and be an active drug for acyclovir. Sometimes people who get these outbreaks, they can kind of tell when it's going to come on, so then they take a medication like that beforehand and it can stop the outbreak from coming out. It doesn't mean that they treated the herpes, it just means it's going to stop it from happening. It's called prodromal symptoms. They can feel it coming on. And then HSV2 is genital herpes. People with HSV1, when they go down there, they can spread it and it become HSV2. The way I remember that is it takes 2 to tango. It's permanent and it also becomes kind of latent, dormant. And then we have HIV, human immunodeficiency virus, or acquired immunodeficient syndrome. This infectious disease basically reduces T cells, the T helper cells and the T lymphocyte count and function. So for this, there are several drugs that are combined to create a treatment, not a cure. This is called HAART, highly active antiretroviral therapy. What this does is it slows down the replication of the virus. Sometimes this can be called the drug cocktail because it's constantly changing. So HIV patients usually take a combination of 3 different types of medication. You have NRTIs, nucleoside reverse transcriptase inhibitors. Then you have an NRTI, which is non-nucleo reverse transcriptase inhibitors. See, I'm trying to say this thing. Then you have protease inhibitors, which is the protein inhibitors. Then lastly, we have the chronic hepatitis. This is inflammation of the liver, usually caused by hepatitis C or B. So hepatitis B happens from blood or bodily fluids. Luckily, there's a vaccine for this because if you get, poked by a needle stick, an IV, or there's a sexual thing that happened that made this hepatitis appear, there's that. It's very important for dentistry because if we get poked by a bloody scaler or instrument or a needle by accident, there's a treatment for that. Same thing for C, that's kind of how you contract it the same way, but there is no vaccine for this. And most of the time it's asymptomatic. And the drugs used to treat this is kind of the same thing for HIV, but these are used to treat or slow down. And sometimes people who have this are on these medications forever. So you have nucleoside or nucleotide analogs, interferons, and protease inhibitors. That's it on that. So I hoped I helped you guys, and I'll see you in the next one. Good luck studying. Bye.